Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit systems of post-acute healthcare services, including long-term care, short-term rehabilitation, independent living, assisted living, memory care programs, and hospice services available to our neighbors and families here in the Berkshires and beyond. I'm Jenny Sutherland, your host, who at some point will rewrite that intro because it is a mouthful. June Green, who's joining me, you're thrilled you didn't have to read that, aren't you?
I was thinking that as you said it. I was.
Yeah. Yes. And June, you are here from Hospice Care in the Berkshires. Is that a true statement?
That is true.
And June, what do you do at Hospice Care in the Berkshires?
I am a family support services supervisor at Hospice Care in the Berkshires, so that means I supervise the social workers, the chaplains, the volunteer coordinator, bereavement coordinator, and I also oversee a separate program we have called Pediatric Palliative Care that you and I are going to talk about at another InfoSource.
We are. We're going to do a show on your pediatric palliative care program. I think it's very important to get that information out there. And today, I'm very happy to get the information out that we're going to talk about. You mentioned the folks that you oversee, and I just wanted to talk for just a smidge about the chaplains and that support. Can you tell a little bit about that?
We have chaplains at hospice who are what's called non-denominational. So they're really, and we try to get away from saying chaplains now. We try to call them spiritual coordinators, spiritual counselors, because it's not just about talking to people who practice a particular faith. It's also about providing support and discussion with people who may have a sense of spirituality but not be connected to a particular faith or denomination. So our counselors go in and meet with the patients, the families, provide emotional support, and talk about those issues that come up as people get closer to end of life.
Yeah. And I wanted you to talk about that because one of the most meaningful afternoons that I've had in the past 16 years working for Berkshire Healthcare Systems was when you set up for me to go out with one of your people. And it was just so... I don't even know if enlightening. It was like I understood things. I saw the love and support people get, and it was just magnificent. So I wanted to thank you for doing that. And
yeah, they're a fun group to hang out with.
Yeah,
they are.
yeah.
Nice group of people. Very nice group of people.
One of the things you and I did when we first met each other is we did a wellness fair over at the Boys and Girls Club in Pittsfield. Do you remember that?
Yeah.
And you taught me a lot, and I was trying very hard to do my June Green impressions when people walk by our booth and stuff. And I kept listening to you throughout the whole thing, but one of the things you talked about was this form, the 5 wishes. And that is what we're here to talk about today, June. And 5 wishes, can you just give an overview of what that is, and then we're going to get into that?
Sure. I love talking about 5 wishes. I think it's an enormously important document for people to fill out. And basically what 5 wishes is it's a living will. And more importantly, it's a tool to use to have a discussion with your family about your wishes as you get closer to end of life. So it's a way to open up that really difficult conversation about death and dying and end of life, and it walks you through a lot of the decisions and things to make. So it's a really good family discussion tool, but also a legal living will.
And that makes it even more important, besides getting the information out about what you want. It is illegal in Massachusetts.
Correct.
And there are some states where it's not, so you'd have to look up that. But in Massachusetts, yes. And where can folks get a copy of the form?
They can get a copy of the form by calling or writing to Hospice Care in the Berkshires.
Okay.
We're more than happy to give them out to anybody. You can call us at 443-2994 or write to us at 877 South Street in Pittsfield. The other way people can get the form is you can call 1-888, the number 5, wishes, and you can order one through there as well.
And that is how cool you are. You can name off multiple phone numbers to get the information.
I love this document,
I know
so
you do,
I can talk this document, everything about it.
At that health fair, you were like, blah, blah, and I'm like, this is fantastic, and we need to do a show about it. And it is a very difficult topic, but so important for people to understand what their loved one wants and to get their stuff out. So we're going to actually go through the form because it's easy yet difficult at the same time. So we talked about what 5 wishes are, and it can help yourself and your family so everyone's communicating on the right, I guess, plane, yes?
Right.
And even if you fill out the form, you can still change it, yes?
Yes, you can simply fill out a new form, put the current date on that. We would encourage you to tear up, throw away the other copies of the previous form, but it's as simple as filling out a new form, and you have 2 witnesses who sign it, and it's good to go.
Okay, so it's easy to get a hold of. You can get rid of it when you want. You can redo it when you want because things change. And it's important for people to have it so their loved ones know, family and friends know what they want. So far it sounds pretty good, and the part of doing it, and here we go. So wish number 1, the person I want to make healthcare decisions for me when I can't make them for myself. Who do you suggest that people think about as that person to help make decisions?
This is about appointing who your healthcare proxy is going to be. And the first thing to know is your healthcare proxy has to be someone who's 18 or older, and it can't be your doctor. It's meant to be a loved one, family member, friend, someone who you feel comfortable making decisions when you're not able to make decisions for yourself. So and I encourage everybody should have a healthcare proxy. Once you reach the age of 18, you should appoint a healthcare proxy because you never know when something may come up. Yeah. And so it's just as simple as appointing who that person will be. I do encourage people as well to have a conversation with that person, because what we find sometimes happens is people will appoint someone their healthcare proxy and not tell them. And then when something happens, all of a sudden they're realizing, and some people aren't comfortable with that role. Some people really don't want to be in that role for their loved one. And it's important to let people know, and have that discussion and say, okay, I'd like you to be my healthcare proxy. Are you comfortable with doing that? And I'm going to fill out this 5 wishes to tell you what my wishes are, so that you'll know if a circumstance occurs exactly what my wishes are.
Yeah, and I like that you really stress that about, you might want somebody, but they might not be comfortable doing it. I can think in my own situation, I've thought, who would I want to be this for me? And I'm like, I can't ask this family member because it's clearly too much for him to do that. And it wouldn't be fair to him, and I would just stress him out more. So really thinking about that and talking to them about it is great.
Can I add one more thing about it?
Sure.
I just realized I forgot to say, too, that I strongly recommend that you choose a healthcare proxy who ideally lives in close proximity to you, because it's really hard when someone is the healthcare proxy living in New Jersey or living in another country. It's a lot harder for them to fulfill the role.
Sure.
So being thoughtful about that piece, too. I just wanted to make sure I said that.
That is a good point, and I'm glad you got that in there, because I wouldn't have thought of that, and I didn't think to really, even though I read the form. That's good to reiterate, because in those situations where this gets invoked and needs to move forward, you want that person close to be there.
It's easier for them.
Yeah. No, it really is. Good advice there. And that person, I'm reading this part because you name the person on this side of the page, and the other side it talks about what the expectations could be of your healthcare proxy, this person who's going to help make decisions. And some of those responsibilities could be like what?
Well, the things people most typically think about are things like making those key decisions about medical care, about what medications a doctor might recommend, and authorizing that that's okay, and making decisions about treatment. But then the healthcare proxy also can make decisions and may need to make decisions about where you're going to be, as in, if you're getting close to end of life, are you going to remain at a hospital, or are you going to come home and have hospice, or are you going to go to a facility where you can also have hospice? But they make decisions about a location a person might be in. They also could potentially make decisions about organ donation. Sometimes people haven't thought about that, haven't filled out an organ donation. They can look at that. The other thing is, sometimes the healthcare proxy has to fill out some legal documents, some things like application for Medicaid, Mass Health, things of that nature. A healthcare proxy would also do.
Okay. And again, things that before I read this I would have never even thought about. I had thought about, for myself, I want someone, if I couldn't make decisions, to do that, but I wouldn't have thought to get into that much detail, even in a conversation. So that's really helpful to have that spelled out, what it could look like. And I love that there's a spot on the form where you can write your own stuff in, because I always like my stuff, my ideas to be out on the form, and you like that too.
Yeah, and there's multiple spots actually throughout the form where you can personalize it even more beyond the things that they guide you through in the form.
All right, let's see where, and we are on, that was wish number 1. Wish number 2 gets a little more pinpointed on what kind of care a person would be looking to get, and how far, I guess, the care would go, and stuff like that. And this one, I think, when I've heard you talk before, you spend quite a bit of time with. And again, this can change, yes, just because you do it. So can you talk about wish number 2, my wish for the kind of medical treatment I want or don't want?
And that's about expressing to your healthcare proxy, to your loved ones, letting them know through this document what things you would want if you were unable to make decisions for yourself, if you were, say, in a coma, what would you not or want or not want to have done, if you had brain damage, if you walking through very specifically about the types of life support you would want, because some people will say, if I was unable to make decisions for myself, I might want to be resuscitated, but I don't want to be put on a ventilator, or I want artificial nutrition, or I don't want artificial nutrition. There's a lot of different decisions. Most people in the general public think of it as being just, I want things or I don't want things, and they don't realize there's a lot of little steps along the way that a doctor's going to be looking to you as a healthcare proxy to make decisions about. You know, what specifically do you want, and under what conditions? Because most people will say, if I'm fairly young and God forbid I get electrocuted and my heart stops, I want to be resuscitated because I got a chance of coming back and having quality of life. But as I get older, if I've lived a long good life and I'm ill and my heart stops, do I want to be resuscitated? Maybe not. Some people do. Everybody has to make their own personal decision about that and educate their healthcare proxy about what their choices would be. Because this whole document is about making it easier on your healthcare proxy, empowering your healthcare proxy with knowledge that's come specifically from you, so that they know exactly what your wishes are. And obviously it's not going to walk through every circumstance that could occur, but it walks through the majority of them.
And after hearing you say that, when I have thought about this form before, I'm thinking that, and it's all about the individual, but in a sense, when you fill this out, you're also taking care of a loved one that you trust and making it easier for them. So I feel it's very responsible to fill out this form, because the person I choose, I don't want to put any more burden on that person in a situation that has to be looked at for me. So I think that's an important thing to say. And so thank you for bringing that up and putting that.
Not everybody's choices are going to be the same. Given a certain circumstance, you may choose something very different from what I would choose. And if your healthcare proxy, if you haven't filled out this document, they may not really know what it is you want.
Yeah. And casual conversations when it comes to these kinds of decisions. Well, we talked about that 4 years ago at a campfire, and that's not really what you want to go by.
Not necessarily, and people don't always remember what you said. And they know what their own wishes are, but they may not know what yours are. So when you put it in writing, it makes life a lot easier.
It does. And we're going to stop for just a second, June. We're going to take a break, watch a clip about hospice care in the Berkshires, and when we come back, we're going to finish off the 5 wishes. June Green, stay with me now.
Okay.
Nestled in the center of the picturesque Berkshires of western Massachusetts, Hospice Care in the Berkshires has served the county for more than 30 years. Hospice Care in the Berkshires is a proud affiliate of Berkshire Healthcare, the state's largest nonprofit provider of nursing, rehabilitation, and senior housing in Massachusetts. Berkshire Healthcare is committed to fulfilling the health and residential needs of the people in the communities we serve. Hospice Care in the Berkshires offers comfort, compassion, and the emotional and spiritual support families and patients value when faced with life-limiting illness.
When my mother-in-law was diagnosed with terminal cancer, we had hospice come directly to our home. It's where she resided and wanted to have her care done. It was a tough time for the family because it was a shock to find out the limited amount of time that she had. But when we started working with hospice, they came in and worked with us wonderfully. They helped us navigate through all the administrative tasks. They told us about all the services that were available to both the patient and the family, the social workers, the home aides, the nurses, and really helped us get through this tough time.
Our caring, dedicated, and experienced team of professionals supports patients and families where they live, whether it's at home, a nursing home, or assisted and independent living facilities. This team includes hospice-trained physicians, hospice nurses, family counselors, spiritual counselors, and hospice aides.
Oftentimes people ask us, why do you work for hospice? You know, why would you do this? Why do you work with dying patients? And I think most of the people on our team would say that it's an honor to work with people at end of life. It's an honor to try to support families and patients through end of life, to make sure that they are cared for with dignity, that they die peacefully, that their families are supported through that process. It's our goal to make it even a little bit better if we can. We can't change the outcome, but to be there and to support families through the process and patients through the process in every aspect is really important.
And we do try to support both the physician and the patient and family at this time in their lives in whatever location that patient and family want to be.
And I just knew that when I retired, I wanted to be part of helping people that were dying and didn't have someone to be there to support them. I knew that that's something I wanted to do.
Our incredible team of hospice-trained volunteers are instrumental to the support we offer families. Our team of over 100 volunteers helps with transportation to appointments, running errands, and respite for the caregivers.
When you know that you can make a difference and that person is secure and feels not as scared because they have someone to sit there to hold their hand, I just can't tell you how, you just feel like you're floating on a cloud when you leave. And to be there when they actually die and to know that you've made it easier for them, you just can't explain that.
Hospice Care in the Berkshires is grateful to the many people who make donations. All the funds raised support the agency's community programs and services, an integral part of how we serve Berkshire County.
Bereavement services at Hospice Care in the Berkshires are funded through philanthropic dollars from the community, and that would include donations, memorial donations, and also community events that we have, such as our gala, our remembrance walk that we have every September, and that allows us to provide bereavement services to all members of the community, not just folks who were hospice patients' families.
I would definitely recommend Hospice Care in the Berkshires to other families. Again, the range of services was wonderful. In fact, I love the organization so much that I now volunteer and help other families who are going through it.
Choosing hospice isn't about giving up on life. It's about choosing the support needed in order to live a full life right now. For more information about how Hospice Care in the Berkshires can help, call us at 413-443-2994.
Welcome back to InfoSource, and with me today is June Green from Hospice Care in the Berkshires. Thank you again, June, for being with me today. And we are going through the 5 wishes, and we are on wish number 3, which is my wish for how comfortable I want to be. And again, when I heard you talk about this at that health fair back in the fall, never thought of any of this. And you brought up a specific point that you met a person who did not want their feet touched, and that was included. And I thought, you know what? I don't want my feet touched either. It really bothers me. And I would have never thought of that. And so can you talk about people's comfortability, what some people say and want?
This section of the document is about things like like you said about, would you want things like massage? Is that something you would like to have someone do to make you more comfortable as you get closer to end of life? It also talks about things like, do you want music played, and what kind of music do you like, and what would be comfortable and relaxing for you? And the biggest part of this is it also talks about what you want for pain management, because some people, as they get closer to end of life, the priority is about, no matter what, being able to be more alert and aware of what's going on in their surroundings, so they're comfortable with tolerating a high degree of pain. So it's making it clear that it's more important to me to be as alert as I possibly can. Other people will say to you, like me, I'll say, give me as much medication as you can because I don't want to be in pain. And so it's about giving your healthcare proxy information about that important thing about pain and what kind of how you want to be treated at the end there, and what you would want as far as being medicated or not. People have different thoughts about that, and it's interesting because a lot of people say, I don't want to be in any pain at all. But some people, as we see, really do feel like it's more important to be able to be alert even for that one special family member who might come around that they know lives out of town. So you'd say in the document, until I can see, my sister Mary, keep me as alert as you can so that I can accomplish that end-of-life goal. So it's about explaining those pieces about comfort and what you'd want. And those aren't things that people typically talk about, so it's important in the document that we go through that.
No, it's so true. And so it's set up so loved ones aren't guessing what you want. And again, a hard situation, but you can turn it into a winning thing with knowledge shared. So yeah, your comfortability. And I don't think people equate, comfortability with that. And that's another way of dispelling the myths that are associated with this. So yeah, definitely don't want my feet touched. And no one really wants to touch them because of there's some fungus going on. So, all right, my wish for how I want people to treat me.
And that's about, the most important part of that is about talking about at end of life. Are you someone who it's particularly important and a goal to have someone with you at end of life, or are you okay with that? I might be alone, and for some people that comes into that discussion about faith. Some people, very strongly believe God is with them at the hour of death, and they're not so concerned about whether all my family members are gathered around every last minute of that time. So it's about those decisions, about whether you want to be alone or not, whether you want someone to come and do sacrament of the sick. Is it important to you to have your minister or your spiritual leader come and be with you at that time? Those kind of things about comfort.
And I think that's an important thing, so people know that you want what you want and you don't want what you don't want. So we're on wish number 5, and I think this is a nice way for the person to let people know what's going on. It's my wish for what I want my loved ones to know. And I actually started crying because this is one area, when you talk about the form, by the time you get to this one, there's not a lot of time left. But this is important, I think, for people to know.
This one is about, and this is where it gets very personal in the document, where there's a lot of sections where there are open sections to fill out. This is about talking about final messages that you want to leave to loved ones, that you want to tell your healthcare proxy. Please make sure certain people know that I love them. And it also is a section where you talk about things like funeral arrangements. Do you want to be cremated? Do you want to be buried at a particular location? If you are cremated, where do you want the ashes? Those kind of things. It walks through that piece, and it's very personal, just those last personal messages, things that you want to leave for your loved one.
Well, I just want to share. My father passed away very unexpectedly, and my mother and brother were just couldn't go through it, and I had to do a lot of the arrangements, and so we went through the whole process in the best way that I thought and what my dad would want. And then 2 years later, my brother goes, we have a problem. And I'm like, say what? yeah, Dad wanted to be cremated and we buried him. And I'm like, really? That, you know, 2 years later, exactly.
Now you tell me.
And, you know, I totally can appreciate this. And I think it's so important because, you know what? I know that I did the best I could, and I hope my father is cool with everything, but I can't really do a lot about that right now.
Right.
And again, some people can deal with stuff better than others. So when I said I wouldn't ask somebody in my family to be this person for me, that would be my brother. But I know that about him because I've seen him witness that. But there are other folks I would. So your recommendation is to everyone fill out this form over 18, to have conversations with the person or people that you pick to do this. Keep an updated copy of it. And again, you can get the 5 wishes online or through Hospice Care in the Berkshires. And you just want people to do it. Is that correct?
Absolutely. I think it's just so important for people to do, and to empower your healthcare proxy, and to just to open up those discussions, because unfortunately a lot of us wait too long. And if, you know, when you can't talk anymore, you can't talk anymore, and people have to guess if you haven't filled out one of these documents.
Well, thank you, June, for joining me today. We've done it again. We're at the end of the show, so thanks so much. I'm Jenny Sutherland. This has been a InfoSource, a presentation of Berkshire Healthcare Systems. Till next time, good health and good life.